In this video, we are going to study the urinary retention. The urinary retention refers to the inability to completely or partially empty the bladder. It depends on the condition. Some mild condition may only be difficult urination. The urinary retention, we need to differentiate with the painful menstruation that we're going to introduce in next video. The urinary retention is focused on the retention. The patient presents as difficulty urination. Difficult urination without pain. Painful menstruation, in the Chinese term, 临症, L-I-N, 临症, it refers to the painful menstruation. Although these two diseases are related to the urination, but the causes, the symptoms are very different. So we need to differentiate from these two diseases. The urinary retention nowadays, especially for the severe cases, which means the patient cannot urinate at all. In the severe situation, we will send the patient to the KUT as well, because nowadays, because of the technique such as the urethral catheterization, make the urinary retention not that difficult to treat. So for severe condition, we have to send the patient to the KUT. For the mild condition, if the patient suffers from difficult urination or difficult to pass, but the patient still can pass the urine, then we may perform the treatments. This disease mostly happens in senior patients. Ladies after giving birth, or patients after post-surgery. The urination is very closely related to the bladder. So the urinary retention, this disease, is the location of the disease. We need to focus on the bladder. This bladder qi. However, as we mentioned previously, the sanjiao is the pathways of qi, blood, and water. So the urinary retention, we also need to focus on sanjiao, especially the lower jiao. So we need to focus on recovering the lower jiao function. We need to focus on enhance the bladder function. So many focus on the bladder and sanjiao, especially the lower jiao. The etiology, it may due to damp heat, liver stagnation, blockage, kidney qi deficiency. No matter what kind of causes, we need to unblock damp heat, liver qi. So you will go through the symptoms by yourself, and then the treatment principles, activating qi circulation, damp heat, acupuncture only. Room 4, spleen 6, spleen 9, bladder 28. Room 4 is the local point. Room 4 and spleen 6, these two are the meeting points of the in meridian. This can enhance the liver, the spleen, and the kidney function. When we said we focus on the bladder, we also need to focus on the kidney, because the kidney and bladder are coupled organs. Spleen 9 can induce urination. Bladder 28, this is the extra points of the bladder. And then, according to different surgeons, you're going to at these points. Number 2 can clear the dampness. Rung 3 and number 2. Number 3, Sanjiao 6, can help to clear heat, activate the qi stagnation, activate the qi circulation. Blood stasis, blood 17, spleen 10. Kidney deficiency, blood 23 and kidney 3. Auricular acupuncture, electrical stimulation, you can keep longer, you can keep the duration longer. Moxibustion. So these are the detailed process of how to use the room 8 for Moxibustion. This technique for urinary retention, because the urinary retention is not really very common in our practice, so we don't really focus on this. But if you have the chance to see this kind of patient, if you want to perform acupuncture to treat this patient, you may perform these treatments. However, you need to monitor well, especially for Moxibustion and the acupuncture. Actually, for both acupuncture and Moxibustion, after you perform the treatment, if you don't see any results in 1 hour, you have to send the patient to KOT if in a severe situation, because these treatments, if it works, it should work quite quick, quite effective. If it doesn't work, you shouldn't perform the treatment and ask the patient to come back and wait till tomorrow. If the patient suffers from urinary retention, you must see the results in a very short period, a few minutes, a few 1 hour. You must see the results in a few hours, 1 hour, even in a few minutes. As explained previously, urinary retention, for the milder condition, you can use acupuncture to treat, but for the severe condition, if the patient cannot pass urine completely, you must send them to the KOT. Also, the urination. For urination, you have to find the cause of the difficult urination is due to the kidney, scanty urine, especially if the patient accompanied with other symptoms such as dizziness, palpitation, tachycardia, edema, nausea, vomiting, even unconsciousness, or even more severe situation. You need to consider the root cause of the retention, the urinary retention, and focus on the cause, or even send the patient to the hospital. Thank you for your attention.